COVID-19 outbreak in New Hampshire has rapidly evolved over the past 48 hours. On Friday, we declared a proactive state of emergency that allows us to take preemptive measures to ensure that we have the resources and the flexibility available to respond to this developing health emergency. For many people, and especially our kids, this can be a scary time. There's a lot of uncertainty with what's going on. Our job is to ensure that the people in New Hampshire are safe, they're comfortable, and they're informed. Over the coming days and weeks, more announcements will be made as the situation is constantly evolving. It's important to remain calm, to really be there for our kids, to come together as a community in this moment of crisis. The goal with our communities and with our children is to be resilient, not to panic. Our kids will remember how their homes felt a lot more than they'll remember the actual impacts of the virus. The community and the spirit of the Granite Staters is unmatched. We know this. And when we work together as neighbors and friends, we do it really, really well.
Today we are announcing a total of 13 individuals in New Hampshire with COVID-19. That is an additional 6 individuals since our last report on Friday. All of these new cases are believed to be travel related, either international travel, as is the case with 4 individuals, or domestic travel, as is the case with 2 of the individuals. I also want to make mention that late Friday evening we announced a 7th case, but had not identified or announced specific risk factors for that individual. We have since learned through our public health investigation that the case we announced on Friday did have domestic travel in the days prior to illness onset, and so we believe that the 7th case is likely to also be a travel-related infection. So to summarize, in total we have 13 COVID-19 cases identified in New Hampshire. All of them, we believe, are either travel-related or are identified close direct contacts to someone with a COVID-19 diagnosis. Therefore, I just want to stress that it's important for people to take appropriate steps and precautions to protect our families and our communities, and at the first symptoms of not feeling well, to stay home. This should involve employers who screen their employees for symptoms before work, and if employees are identified who are maybe feeling unwell or having mild symptoms, they should be sent home. So I think we need to change our social expectations and make it okay for people to stay home when they are sick or symptomatic, even with only mild symptoms.